143. The title of today's lecture is Emotional Wellness. Stress Management Techniques to Handle Grief and Anxiety. 144. We know that stress management experts tell us that we have an emotional response to any physical change in our health status. We have to learn through stress management as to how to cope with that change and control the emotional response. Coping is defined as a response to prevent, avoid, or control the stress arising from stressors such as your ill health. Grief is a natural response to any loss of any kind, including your health, your normal way of life, and that grieving stage is broken down into 5 areas. Those 5 stages of grief have been established as a normal response emotionally to the changes that occur to you physically. The first response or tendency of grief can be denial. This isn't happening to me. It can't be happening to me. I'm in shape, have a pretty good diet, not aware of any family history. So it may be that we just deny the whole situation. In fact, most people experience this when they start to have a heart attack. There's no way that I'm having this heart attack. This can't be me, and I'm shocked. That can result in anger. Why is it happening to me? That anger can range from mild irritation or aggression all the way to the end of the spectrum of rage. The anger can be directed toward yourself, internalized, or others. A lot of people experience different ways as to how they act out anger. Some people clam up and don't talk as they get angry. Some people can't stop talking as they get angry. Manifests itself psychologically and physiologically and behaviorally. So anger is going to be manifested in some form and directed outwardly. Bargaining, not uncommon for us to see this, especially in terminally ill patients. I promise if I get out of this situation, I will not do what I was doing before. I'll have a better diet. I'll start exercising. That may be that when you don't get back what you bargained for, it can lead back to anger. So we see that happen commonly. When we experience denial, we get angry about it. We may bargain to get out of the situation. That can lead to depression, resulting in behavior or thoughts like I don't care anymore, more than the ups and downs of daily life. It is I've given up more than coping with ups and downs. Emotional attachment with acceptance affecting how one thinks or feels, how you behave, how you change your views of the world, how you associate with other people, how you act out in terms of your anger. All those things are symptoms that can result in loss of pleasure and interest in activities that you've once been interested in. Often people isolate. Sleeping patterns can be changed and affected when you're stressed out. You can feel hopeless, helpless, or worthless. Where we want you to get to, and that's the definition of coping, is I've accepted that I've got a change in my health status. I've not been singled out. The majority of the population has this very health problem. I'm going to accept it. I'm ready to go on, and I'm going to emotionally adjust to my new health status, and I'm going to improve it. 145. So it's important that we recognize the symptoms of anxiety. We know that anxiety affects us both psychologically, and as a result of that, physiological responses occur. The sympathetic nervous system is activated to prepare us for a condition called fight or flight, meaning we're preparing for a high level of activity or response, which leads to a release of the stress hormones and an increased amount of fuel that is dumped into the system to give us the energy to perform at a high level. That activation of the sympathetic nervous system, or the somatic responses that we call that, increases heart rate, can lead to palpitations, can cause us to sweat in that excited state, can lead to earlier chest pain. Muscle tension occurs because we're preparing for a physical outcome. Digestion problems can occur because we route the blood flow away from the digestive tract to the working muscles in preparation for the high expectation of the physical experience. Can change our sleeping patterns. Of course, when our heart rate and blood pressure are elevated, we have more of a problem with sleep. Anxiety behaviors can manifest themselves outwardly in behaviors such as nail biting, hair playing, teeth grinding, facial rubbing, lip biting, foot and leg shaking or tapping, rocking back and forth, or just the physical choice of isolation. Emotional responses and symptoms to the increased somatic response is you feel apprehensive. Your heart rate and blood pressure are up. Those can lead to feelings of dread. The physical demand can lead to trouble of concentrating. You feel irritable, tense, or jumpy. You anticipate the worst, and you're just restless. You have restlessness. So those lead to thoughts that are such that I never can get better. Will you ever get better? Yes. Everything about your physical condition can get better and improve. I can't go out. Of course you can. Those are just anxious behaviors that make you think that you can't be seen or you don't feel like you can go out. Everyone is staring at me. Of course, there's no one staring at you because you're not physically changed outwardly in most cases with heart disease. I feel confused and can't remember anything. Often accompanies the feelings and reaction of anxiety, but also it can be part of being under the situations of anesthesia and some of the things that are involved in a heart procedure. 146. It's important that we recognize our stress and change our outlook of that stress. In other words, we can't often remove ourselves from the stressful situation, but we can change our approach and view of the stressful situation. Stress is the body's response to any problem or stress or change that occurs in our normal lives. Everyone experiences stress, and a lot of people avoid stress, but learning how to constructively manage stress can be a positive element in our daily lives. It's our response and attitude about the stressful situation that matters. There are two kinds of stress. Eustress is a good stress. An example of eustress would be physical stress such as a competition or exercise. Mental stress such as a project or a deadline would be an example of eustress. The bad stress is called distress, and it's very important for us to recognize and be aware of the signs of distress. Often our sleeping patterns change, leading to chronic fatigue, for example. We can get irritable. We can lose our temper more often than we used to, or more easily. Decreased concentration, or you get more impulsive. You're just generally depressed. Your eating may be affected, your eating patterns. Some people eat when they're stressed out. Some people can't eat when they're stressed out. May have a nervous stomach, nervous tick, or you're just bored with things that you didn't used to be bored with. You may be accident prone. So these are some of the behaviors that you take note of to realize whether or not we're in a stressful situation and recognizing stress. 147. So it is critical that we learn how to cope with the stressful situations that we run into on a daily basis. So what can we do? Remember, the goal is not to have a stress-free life, but to recognize what you're feeling, what stresses you out, what causes that situation, and what can I do about it. Learn to express your thoughts and feelings. Talk with family members and your healthcare workers. Surround yourself with a solid support group. Prioritize your problems and your obligations. Be realistic and take it one day at a time. Set realistic goals. Focus on what you can do rather than what you can't get done. Learn to divert your attentions and plan days of activity ahead of time. Avoid stressful situations that you know are going to be a problem with your ability to cope with that situation. Maintain your humor. Exercise. Exercise changes how our body handles emotional stress by way of adding the physical stress or the good stress. Learn how to relax. Schedule time of relaxation. That helps to restore your energy and improve your state of mind and ability to cope. The benefits are endless. 148. By adding relaxation techniques, we can increase our ability to handle emotional stress. Breathing exercises can help you relax because they make your body feel like it does when it's already relaxed. Deep breathing is one of the best ways to lower stress in the body. It's because when you breathe deeply, it sends a message to your brain to calm down and relax. How is it that we perform these deep breathing exercises? We inhale slowly through the nose for 2 seconds, then exhale slowly through pursed lips 4 seconds. We can add to that, in other words, during the time we're deep breathing, we can add meditation. That can include visualization and mindfulness. Visualization would be during the time you're deep breathing, close your eyes and use all your senses to mentally put yourself in a peaceful place. That could be being at the beach, in the mountains, etc. Mindfulness, you focus on one activity at a time, staying in that present moment while you concentrate on what is in your surrounding. That can be sounds, music, poetry, books on tape, podcast, and scripture. Those are all things that you can add in a meditation way to have pleasant thoughts during the deep breathing relaxation technique. Another thing you can do during the deep breathing technique is progressive muscular relaxation. Close your eyes and breathe comfortably. Breathe in and out as instructed. Tense up the muscles and gently release, slowly releasing before you move on to the next muscle group. Of course, adding to the stress relief condition is your exercise program. It increases the release of endorphins, helping you improve the mood, self-confidence, and gives you a sense of control and overall energy. Self-soothing practices, such as taking a warm bath at night, taking a swim, those types of things can be relaxing and change the emotional state. Social interaction with pets, friends, those kinds of things help decrease stress. And remember, the power of touch is unbelievable. 149. So hopefully we've learned and continue to learn to recognize our stressors and anxiety triggers. We have to pay attention to ourselves and the symptoms associated with what causes us stress and anxiety, and practice new ways to cope and maneuver through these life stressors.